Welcome to Cannabis Marketing Live. I am your host, Jake Litke, the CEO of MediaJel. And today we have Len May on the show. Len has, as you can see, quite a bit of rock and roll history. That's not what we're going to be talking about today, although I am going to ask some questions about the pictures on your wall at some point. We're going to be talking about the genetics of cannabis. So, Len, why don't you go ahead and introduce yourself and what your company is and what you're trying to achieve.
Yeah, thanks, Jake. Appreciate it. So I'm Len May, as you said, and the CEO and co-founder of a company called EndoCanna Health. What we do, we're a health technology company. So we use DNA to guide people to a personalized experience, looking at their full endocannabinoid system. And yes, we're focusing on phytocannabinoids, but we're also looking at the entire genome. So we're able to look at personalized nutrients, vitamins, anything that's looking at precision therapeutics or precision medicine. I've been in the space for 26 or whatever many years, not only as a patient, not only as an activist. I was the president of the Cannabis Action Network. I was an owner and operator of dispensaries, delivery services, but my passion has always been the therapeutic properties of the plant. And the thing that I was trying to solve is why two people can consume the same cultivar and have a completely different experience. And I actually thought it had a lot to do with the plant genetics itself, but over time, it has to do a lot with the plant genetics, our genetics, because it's really complicated. There's a lot of different factors. So that's what the idea is, to solve this for people so people would know what to take so they can help to mitigate or avoid an adverse event, how much to take so we can dose specifically for those individuals, and then actually product suggestions as well.
Great. So I'm going to ask you some questions about words that you're using that not everyone might know. So first off, endo versus phyto. Maybe you could explain that real quick, because it's I think a lot of people don't even really understand how much you have on the endo side, right?
Yeah, I appreciate it, Jake, because my dad always tells me, if you're using these words, you got to define for people. Don't expect that people will know. So I'm glad you brought that up. So endo means inside. We produce that internally within ourselves. Phyto means comes from the plant. So we have an endocannabinoid system that produces our own endogenous, another word that means within, also we're creating that ourselves, endogenous endocannabinoids. So they're just neurochemicals. And the plant produces its own properties. There are phytocannabinoids that actually we have receptors in our bodies for the plant to be able, for us to be able to receive those from the plant, bind to our receptors that are within our bodies, and release our own neurochemicals, endogenous endocannabinoids. So neurochemicals can be like, an example would be cocaine, right? So any drug, anything you take, and not that we're having a conversation about, illicit drugs, but I'm saying cocaine is used as medicine. We consume cocaine, it binds to your dopamine receptor and squirts a bunch of dopamine from your brain into your bloodstream. Well, that's the same thing when you consume phytocannabinoids in the plant, binds to your receptors, your cannabinoid receptors, and squirts anandamide, which is an endogenous endocannabinoid. The word anand means bliss in Sanskrit. So this is the molecule that makes us feel euphoric or high, quote unquote. And then 2-AG is the other one. And that's more your body, your immune system, your digestive system, etc. That's what we naturally release. And we have deficiencies that we don't produce in ourselves. We're lucky that we found this plant in nature can actually help to bridge those gaps that we naturally have.
And on the deficiency front, obviously everyone's body is different. What is the spectrum of someone who maybe is very deficient versus not deficient at all? And as far as the research goes, and I do know that we have been sort of crippled for a long time by not being able to do research, which is slowly changing. There's still a lot of things that are unknown, but given the book of knowledge we have today, what is that spectrum for someone who has almost none versus a lot, or am I even describing it the correct way?
Yeah, I mean, there are very little that we have to measure what the amount of endogenous endocannabinoids an individual has. You can get them in certain fluid that's within your brain, but it's very invasive procedures. So what we can go by is twofold. Number one, we can go historically. When cannabis was, before prohibition, cannabis grew and animals would eat, even if it's hemp derived or hemp, animals would eat it. It would be in our food supply, it would be in our water supply. And then after prohibition, we started seeing that there are certain conditions that have been expressed due to the fact of, and there's research on that, to certain deficiencies in endogenous endocannabinoids. Now, having said that, there are also internal challenges that actually control the experience based on metabolic function and based on genetics. So if people have a predisposition and there's a gene called FA, fatty acid amide hydrolase. And I know I'm getting sciencey, but I'll explain and explain why this is important. That gene produces an enzyme that actually breaks down or metabolizes anandamide. So people that have this genetic predisposition actually are producing less anandamide than the average person. And you're looking at about 52% of the population, give or take, that has this predisposition. So you actually have about half of the population that is actually making less anandamide than what the other half of the population is. So looking at their genetic predispositions can help determine what internally they may be metabolizing or breaking down and having less or more of.
All right. So measuring it sort of in vitro is not effective, or at least sounds painful and annoying. And this comes into your approach, right? So going into looking at the actual genetics and epigenetics of individuals.
Yeah, you're absolutely correct. So the idea is we met with the FDA. They said, what is the purpose of your work? What is the purpose of your test? And we said to help people either avoid or mitigate a possible adverse event. Well, what's an adverse event? Well, this gene that I just talked about, FA, fatty acid amide hydrolase, people that have this predisposition actually have predispositions to things like stress reactivity, PTSD, slow rate of fear extinction. So these are the people that you may have met or heard or talked to that say, I can't really consume cannabis. It makes me stressed. It makes me feel anxious. Well, what makes you feel anxious? Well, cannabis. Well, can you be more specific? Well, that's a whole, what do you put in your body? I'm not sure. Well, first of all, you should know what you put in your body. And THC has a very narrow therapeutic window. And we're in this cycle of cannabinoids that we're starting to focus on high amounts of THC that actually, can trigger those epigenetic responses to your genetic predisposition of anxiety and stress, adverse events. So this is what we're trying to mitigate for people, to show them they may have a genetic predisposition towards having an adverse effect. And now you can mitigate that by reducing the amount of THC, maybe increasing the amount of CBD, and changing your terpene profiles based on research that has been done. That certain terpenes may be more sedative, maybe more relaxing, maybe more calming. And if you have that type of formulation, or that is your recipe, now you can go find products that actually fit your sweet spot, and then you actually know how to dose correctly based on your genetic information as well. And that's what we're focusing on. So one part of it is like your GPS, right? So you're looking at your ways of cannabis. These are the potholes in the road. This is where the traffic jam is. This is what we want to avoid. The other part of it is looking at the expression. Well, now that you have the formulation that's working for you, now let's have thousands of people look at that using that formulation and measure the efficacy. And what are we measuring the efficacy of? Well, we're measuring that those genetic predispositions aren't expressed epigenetically. That's one. Number two, we're looking at patient-reported outcome. So how is that working for you individually? Number three, we're integrating biometric feedback. And what I mean by that is your wearable device. So if you have a Fitbit, you have an Oura Ring, you have a Garmin, all that's data, and it's anonymized data. So we're not looking at, Jake's personal information. It's all de-identified. The goal is to use machine learning to be able to start making predictive inferences. So what I want to know is what's working for me and what works for people that are similar to me. It's interesting. You go by, I had an experience with a friend of mine. We were getting ski pants on Amazon. So I'm 5'8", 175 pounds. He's taller, like 6'1", maybe, skinnier, but we're both wear medium. Well, we both bought medium pants, and my pants are a little long. His pants are a little short. Well, but we both bought medium. So how do we get to a point where we're actually having our own queue of our own products that are specific to us, truly a personalized experience in therapeutics? And that's the way I feel that medicine should be done in the first place.
Yeah, and so it's it sounds like there's a lot of science and analysis that you and your team are providing to what I would describe as maybe a simple to describe outcome. And let's use an example of, you said THC has a narrow range of efficacy. A little bit can help certain conditions. A lot of it can, you can have a bad trip, man. So let's take edibles, because that's the easiest thing for people to measure dosage, right? Even though I know that they express differently inside of your body, it's kind of difficult to say what is a puff or a toke. But if we take an edible and we take a common dosage that you would see, like a 5 milligram increment, 5, 10, 15, you get a lemonade for 100. But what would be a common, like the bottle of aspirin says take 2, right?
Yeah.
If you were going to say the most common dosage level that may have efficacy just for THC all by itself without CBD, is it 5 milligrams? Is it always going to be the case unless someone has a high tolerance? So like 20 milligrams is almost never going to do good things for you. How does that work?
Yeah. So edibles are an interesting thing. And I'll try to put together a scenario and I'll give you an example. So when we consume THC through our first pass, when we eat it, it goes to our liver. And you mentioned there's a conversion. So your liver converts delta 9 THC to 11 oxyhydroxide delta 9 tetrahydrocannabinol THC. So that then goes from the liver back to your bloodstream and binds to those receptors. It can be 5 to 50 times more powerful than combustible or sublingual THC. So besides looking at your metabolic function, edibles can have that effect on people. Now, the thing that's important for dosing edibles is how you metabolize. So there's basically 3 different buckets, and also what type of THC you consume. So somebody can be a poor metabolizer, they can be a rapid metabolizer, they can be a normal metabolizer. There's also an intermediate metabolizer. So you can put those people in those buckets. So the poor metabolizers would look at the 5 milligram or maybe even less than 5 milligram. The average metabolizer are somewhere in the 10 milligram, and then you're getting up to 20 and above. Some people, ultra rapid metabolizers, they've consumed, 20, 30, up to 100 and still, are able to function. Now, the challenge is that you're actually missing that therapeutic window. So just because you're not feeling as euphoric or as high as you may want to, it doesn't mean that THC isn't doing what it's supposed to do. So now you actually have a free radical of an anandamide that's flowing in your bloodstream, and your immune system can overreact to that. So some people can, have inflammatory reactions, etc. So having understanding that where is my dosing based on metabolic function is really important. The other thing is drug interaction or supplements. Certain medications that people consume. People call us all the time that they're on their SSRIs, their serotonin reuptake inhibitors, antidepressants, or anti-anxiety medication. They're saying, I want to get off this medication by using CBD. Okay, well, if that's the case, they're taking them together. And actually, you're inhibiting your SSRI, or you can induce the SSRI. So you need to understand, if you're taking your prescription medication, and we do that as well, maybe you need to wait and stagger. How long you stagger? Well, it depends on how you metabolize. So people that are ultra rapid metabolizers, may they wait 30, 40 minutes. People are poor metabolizers, may they wait for several hours. Here's the other caveat to that. How are you taking your THC? You mentioned gummy. Well, most gummies are isolated THC molecules. So there's 3 different pathways. Once again, geeky sciencey, but there's a series of genes called cytochrome P450. Each one of these genes produces an enzyme that metabolizes something in our bodies. There's one specific for gluten. There's ones for lactose. And there's 3 specific ones for cannabinoids. CYP2C9, that metabolizes THC. CYP2C19, that metabolizes CBD. And CYP3A4, that metabolizes CBD and THC together. So if you're eating a gummy and it's an isolated THC molecule, well, guess what? Now you have a different enzymatic pathway that's metabolizing that. So if you're a poor metabolizer of THC, but you're a normal metabolizer of CBD and THC together, you may want to go with a full spectrum product because you'll metabolize it differently.
Okay, so I'm going to sum up all of that with that there is no easy button for this, and there's not really a solution that you can just say, here's a bottle, take 2 of these, call me in the morning. You need a more analytical approach, and it needs to be more individualized. And that's, I think, why you're doing what you're doing. And maybe you can spend a little time talking about what your technology does. And I'll use technology in a broad sense because you're using a combination of research and software and data analysis. How does it work? Like, tell me about it.
Well, technology is probably the right way to describe it because we are the first company that actually received the patent on our technology. And the patent, and I'm going to paraphrase the patent. So the patent is actually for the use of DNA to guide people to recommendations, suggestions around their endocannabinoid system presented in a graphical user interface. That's what our patent is for. So the way that it worked is when we first launched in December of 2017, the first 6 months, all we did was research. So we looked at every single gene or single nucleotide polymorphism that is directly or indirectly associated with your endocannabinoid system. Once we did that, we had to get references. So every single report that we have in EndoDNA has to have a peer-reviewed reference of PubMed or PubMed equivalent. Not only did we build it on references, but we also build an algorithm that uses machine learning AI to go out and find new studies. So as new studies become available, so it's always dynamically updating. As new studies become available, we'll add that and the report will be updated. The next step in the process is we approached a company called Illumina. Illumina makes sequencing equipment, genetic sequencing equipment, and we asked them to make a chip for us. So they made a chip, just like you would a computer chip. That chip is used to be able to find the genetics, the genes in your saliva, and show you what is your combination of what is your genotype. So we build a chip. We right now genotype about 675,000 SNPs. So not just they're directly or indirectly associated with the endocannabinoid system. And then once we did that, we validated our assay. We created our kit. So currently we get DNA material 2 ways. Number one is our EndoDNA test. It's a buccal swab. So it's a big Q-tip. You swab inside your cheek. We're a HIPAA, we're GDPR compliant. You register that. You would then ship that to our lab. And we're a global company, so you can do that anywhere in the world. Or if you've already taken your 23andMe, if you're taking your Ancestry.com, any other DNA test, you can take your results, your report, upload it to endodna.com. We'll translate that in 30 seconds or less and provide your report. And the report really looks at symptomatic conditions. So unless a doctor orders it, direct to consumer, we're looking at symptomatic conditions, not diseases. So examples would be like anxiety, cognitive function, mood and behavior, pain and nausea, sleep. And I will give you a report that looks at your genotypes based on those symptomatic conditions. And then from there, we would show you if you have a predisposition. It's color-coded. Green means there is no predisposition. Yellow means there's one report that says you may, and red means there's multiple, so exponentially higher chance of that symptomatic condition expressing itself. Then we'll look at drug-to-drug interaction. We look at your predispositions to THC side effects, so adverse effects of THC. We'll look at dosing based on metabolic function, and we'll give you a ratio of cannabinoids and terpenes that which should be more aligned with you. But we take that even one step further. Then we use a marketplace. We use certificates of analysis from different manufacturers. Anybody who's in the business and has a certificate of analysis test result, we'll run that through an algorithm, and we'll show you how close that product matches the suggested ratio. So now you can go in and see if it's a hemp-derived product, you can order online. If it's more than 0.3% THC, then that product is available in whatever state you have. But you can go in with your recipe basically your secret sauce and say, which products do you have that match that? And then the follow-up is the feedback loop mechanism that I described. So now we're looking at efficacy of that formulation, how well that's working for the individual, and we're using machine learning to make better predictive inferences.
Okay, so you have bundled up a lot of knowledge into what seems to be a simple process. And correct me if I'm wrong, if you already have a DNA test or you have your DNA, that is usable as well, right? Like that's
So if you have your 20, the way that it works, say you've taken your 23andMe or your ancestry, you would download your raw data, which is basically a spreadsheet. You can do that from any one of those sites. And then you would take that spreadsheet, upload it to our site. We'll translate that and provide your report in 30 seconds.
That's amazing. And so we're looking at a combination of, when you look at a COA, you're going to get THC, CBD, maybe other minor cannabinoids, but you don't generally get terpenes, right, from a COA. Obviously, if you have some experience, you can kind of smell them, which kind of leads me to a question I have for you. I know numerous people that experienced cannabis consumers that are pretty convinced that they can smell flower, and based on the smell, they can do basically like sort of a gut reaction, sort of relying on the neurons in your gut to tell your body, to tell your brain that yes, I like this, or no, I don't like this. And it's beyond whether it smells sweet or sour, but there's all those complex olfactory things going on. What's your take on the smell test of humans' ability to just think that they can smell it out?
I mean, 100%. I'm one of those people, and Dr. Ethan Russo just wrote about this. And so I'm in California, I'm in LA. We don't have the luxury of smelling anything anymore. They're all sealed bags, sealed packages. I was just in Denver, and you're absolutely right about terpene testing. I 100% believe it should be a standard, industry standard, to test for terpenes, because some of the terpenes actually have affinity for receptor binding, like beta caryophyllene, and there's plenty of studies associated with that. But terpenes themselves, when you smell a ratio of those terpenes and you have that, and the smell is pretty good, you probably are getting the ratio of terpenes that are more aligned with you. And then if you train your nose how to do this over time, you can start smelling like floral. You can start smelling citrus. You can start smelling musky, skunky, and you know what the association of that is. So if it's smelling, fruity, lemony, that's limonene. That sort of gives you a boost up. If you're smelling skunky, more diesely, that's myrcene. That's usually sedative. And something that smells like clove, and you can start smelling it, because all terpenes are found in nature anyway. Plants produce essential oils. You understand that lavender has a certain smell. You buy candles, you buy essential oils. Well, guess what? If that smells similar to what it's in your cannabis, that's linalool. So once you start associating that, and it's not that difficult to be able to associate that because you do that with essential oils anyway, you can start saying that there may be an alignment to what's right for me.
Yeah. Okay. So that's that at least is maybe indicative on some level. It'd be interesting to see how the science unpacks that.
Yeah.
It would also be interesting to see how it's not really epigenetic. I guess it'd be more psychological, which is that if at some point in your life you've been exposed to a certain smell in a negative context, and now your brain is like, oh, I don't like that smell because I used to work at a restaurant that smelled like that, and I didn't like my boss. But does that maybe that overrides your natural smell test? I don't know.
I'm ready to do a study. Let's do it.
Yeah, well, I don't know how we would do that, but we can talk about that later, maybe. Okay, so all of this is in an effort, I believe, to give consumers products that are going to work better for them. Right now, we exist in an environment where you're basically, unless you have a fair amount of experience, and even then, you're kind of like rolling the dice whenever you buy products, and on multiple levels, not just is it Sativa versus Indica, is it a strain or cultivar, and let's talk about that in just a second, but and how those things may not even be the same. But ultimately, a lot of people that are looking for guidance are relying on advice from bud tenders who, let's just assume that they're good natured, right? And they're trying to deliver a product they think will like, and they may ask some questions about, are you looking for energy? Are you looking for sedation? But without them understanding the genetics of the person they're talking to, they're not really able to give accurate advice. Am I correct on that?
It's a really interesting industry. Think about it. Where else, what other industry takes a therapeutic product, entrusts that to one person who has no training in this? I mean, they're bud tender. I'm not taking anything away from bud tenders because they help run our dispensaries. So when I used to have those, but they also have influence. There are companies that are actually using bud tenders to help with street teams and promotion of products. So how do you know that that's genuine? Maybe that's a product that this bud tender really likes for themselves, or maybe they're compensated to recommend that product. How do you know that? And you really have an industry that doesn't have a direct line to, some states do have pharmacists, some countries have pharmacists. If you have a pharmacist there, they can make that recommendation. It makes sense, but you actually have a bud tender to do that. And without knowing their genetic predispositions, without knowing their past history, that can create some challenges. I'll give you two examples. There was a Grandma Mary. So Grandma Mary, I talk about this in my presentations. She was diagnosed with cancer. She went to a dispensary and she was given some gummies. And I guess 60, whatever many years ago, she had a brownie somewhere and had a pretty intense experience, but time she forgot. So she took one gummy, waited for a while, and waited some more.
I know how this story
didn't
goes.
take any more. But then she started feeling anxious. Well, THC is a vasodilator. It'll dilate your blood vessels, your heart will pump faster. This is normal. But if you have predispositions to stress reactivity and PTSD, here's what can happen. Number one, it can trigger that stress reactivity gene. So now you're secreting more cortisol in your bloodstream, your fight or flight starting to kick in, PTSD gene kicks on. Now you're saying, oh shit, I do remember that experience that I had 60 years ago. So now you may be reliving it again. And she said she got such an intense experience, she started hallucinating. She was high for like 2 days. This is off one gummy. And now,
which gummy?
Who knows? Yeah, who knows? It was 10. Who knows? It was 10 milligrams. Who knows? I don't know what it was. I think it was in Arizona, if I'm not mistaken. So I don't know what was in that gummy, but let's say it was 10 milligrams the way it's supposed to be. So if I looked at her genetic profile, so first of all, this is what happened. Number one, she went back and said, no more of this. I'm never putting this in my body again. It doesn't work. It actually makes me feel bad. Number two, she told everybody else in her assisted living facility, stay away from devil's lettuce. So think about this. One experience that's a negative experience or an adverse experience can actually lead to a person not moving forward and addressing their needs, but also spreading this propaganda because they had this negative experience in themselves. So if I looked at her genetic profile, which I did, number one, she was a poor metabolizer. So eating THC probably wasn't her best idea. Number two, she had all those genes that I mentioned, and she also had a genetic predisposition for psychosis-like effects. So basically, through all that stress, it triggered a dissociative experience. Once we dialed in her formulation, which was a lot more CBD, a lot less THC, a complete different terpene profile, sublingual delivery, so like a tincture, she actually was going around where she was getting her chemo. She was going around giving her business cards to people and saying, oh my God, this is working so well for me. You have to call these people. So that's an experience that people deal with every day. There's an article that just came out recently. And by the way, I'm a huge proponent of cannabis. So I'm not saying this in a negative way, but there's an article that came out, the hospital visits for older people in California have increased by over 1,000%. And one of the reasons is because when California went recreational or adult use, whatever you want to call it, the amount of THC in products has steadily increased. So there are so many different dab products and concentrates and all these other things. There's very little therapeutic products, not as many one-to-ones, not as many lower dose products. So people are taking products that their friends recommend to them, but they metabolize those differently. And then they end up, in the emergency room because they're having an anxiety event or something, or a psychosomatic event. These are the things we want to mitigate for people so we can kind of get out of the shadows of this, this as an illicit substance. So that's why I think it's extremely important to be able to, and by the way, it's not just about cannabis, it's about any substance that you take. You were telling me about acetaminophen take 2. Well, for some people, 2 maybe taxing their livers. Some people, they may need 4, maybe they're rapid metabolizers. But they found through clinical trials that, as you mentioned, there's a sweet spot that if you take this, you're most likely not going to harm somebody. Doesn't mean it's going to be efficacious. You're not going to harm anybody, most likely. And that's the first step in an FDA process. And that's the first step that we have to get to in cannabis to make sure that we mitigate those conditions. So then we can get focused on efficacy.
So let's take all of that and try to translate that into a commercial setting, right? Into A, product development, B, product marketing. And I'll share a fun old marketing story about dosage, right? So Alka-Seltzer, right? Plot, plot, fizz, fizz, one of the more successful marketing campaigns ever, was actually a function of a business decision, which is that they wanted to sell more products. The original dose was 1. They didn't actually change the product at all. They just said, hey, you should start taking 2 of them now. And they turned that into a marketing campaign, right? Instantly doubled their volume of sales. Now, I'm not saying that's what you should be doing, but how do we take, because this is a nascent environment for people. A, you have to educate people. You or a product manufacturer that wants to have your seal needs to educate consumers of the value of doing the testing and understanding their own body better. And then the next step is they somehow need to integrate that into their packaging. And I think you've got a portal where people can discover products that are in line. That's correct, yeah?
Yes.
But you have to get people to that portal, right? And most people are going into dispensaries. So how do you cross this chasm of getting to the point where you can educate a bud tender about what this particular, let's say I have started a new product and I have like what would you call it? Like a profile that I would put on there that like this product matches this particular profile.
Right. Correct.
Yeah. Where are we at in that cycle for this information?
Yeah, I mean, it all depends on the states or the countries. So I'll give you a couple of examples where I think it's successfully being utilized, and I'll tell you where there's room for improvement. So let's say Brazil. So Brazil is a fully medical country. A doctor can prescribe cannabis in Brazil. However, and we're still training doctors all the time, they may not know cannabis that well. So in order for them to say, I believe, based on my research, cannabis can be something you can use. Now, I recommend taking an endoDNA test because that way it'll show you what to take, how much to take, and then we can pinpoint you to these products that are available for your shelf. So that is a great way to be able to utilize that. In California, where we have a recreational platform, and in Florida, it works differently because it's a medical estate and fully vertically integrated. But in California, you actually going into a dispensary and entrusting a bud tender, like we talked about before, to show you which products may be best for you. Well, how do they know that? First of all, we can't make any claims, so we don't know if it's really therapeutic or not. Number 2, dosing is by the package. We don't know what that dosing is individually for me. And number 3, nobody can ask you or shouldn't ask you, are you on any medications? Are you taking any supplements? So there should be a layer in between that actually allows an individual to say, okay, I'm going to take my DNA test, or I'm going to upload a raw file from my 23andMe. Now, when I go back to my dispensary, I can actually tell the bud tender, hey, can you show me all the products that you have that are maybe 1-to-1, or maybe they're 20-to-1, or maybe there's products that actually are prominent in linalool and beta-caryophyllene because I need something to reduce my stress and anxiety, but without being sedative. So now that you kind of have your formulation, you should be able to connect that with products that are on the shelf. Now, in full disclosure, we also have 8 patent pending formulations that we've developed, and we license those formulations to manufacturers around the world. So if it's a product that they want to manufacture with actives, THC, et cetera, they can get our formulations and use those and white label them under their branding. But the idea is that the challenge in the industry is a lack of uniformity. So because I can get a product in California that's similar, I cannot get that same product in Pennsylvania. The testing protocols are different in different states. So in order for us to be able to have this industry move to the next level, looking at maybe a nutraceutical type of industry, besides pharmaceuticals, or looking at individual molecules. This is a complex plant. You have over 400 different constituents that we identified. Plus, we're complex. Our genetics are different. Our epigenetic expression is different. So getting people to align with those is difficult, but at the very least, you have to create an equal playing field. So the testing standards, as you mentioned, terpenes. Well, why are we not testing for cannabinoids and terpenes across the country? What are the standards? That's something that should be done for any nutraceutical. I go get a label in my vitamin shop or I get my vitamins in my vitamin shop. I look at the label. Okay, it gives me all the nutritional supplement facts. This should not be different if I go to Pennsylvania vitamin shop. It'll be the same exact product. So that standardization needs to happen in the entire industry. And that way we'll be able to help people much better and understand, because we're looking at uniformity of products besides what labels on the brand.
Okay. So today I could go, I could take one of your tests, I could upload my DNA, you can give me a map sort of what my interactions might be with different types of products and dosage levels. You have some formulations that you've licensed to people that match those. You have some products that aren't your formulations that kind of fall within the parameters of sort of recommended, personalized recommendations.
Right.
So for me, I'm in California. I could go to your site. Let's say I've done my test, and you would say, okay, here's some products that are good for you, and you'd point me to some potentially local dispensary or delivery service that would carry that product.
Yeah, correct. So the way it works, it gives you a percentage of match. So it'll show you that, this product that's a 1-to-1 or whatever it is, it's a 78% match. We're integrated with different services like Leafly for Surma. So you can go in and see which dispensary closest to you will carry that specific product, or you can just go into a dispensary and look at their menu. Now, the only caveat to that is flower. And we got to be really, really careful when we talk about flower, because it can show you that a certain, cultivar or strain, and we can talk about that too,
Yeah.
has a certain profile of their genetics and their terpene profile. However, that batch doesn't necessarily mean that it's going to be that specific profile. So you have to still look at the C of A for that batch. So if I'm looking at a cultivar called forbidden fruit, normally if I go into a database like Leafly and I look at forbidden fruit, I'm like, oh, well, that is my sweet spot. That has the right terpene profile for me. But when I actually go into the store to buy the dispensary, well, the test results are different. And the reason for that is because we slap these names on these cultivars that really are meaningless. They're really marketing pieces, because there is no more landrace, cultivars. They're all inbred, and there's hybrids of these different things. So that's the thing that So interbred, yeah. So we have to be really, really careful of understanding that this whole notion of indicas and sativas and all that stuff, they're all hybrids. So you have to look at the terpene profile based on that, see which way it's leaning, like a little bit more sedative, more indica leaning, or more sativa leaning. But you have to actually look at the test results of every one of these cultivars to see what are the results. Because even in a cultivation facility, you can have genetic drift. You can have a little more light on one than the other, and how you cure the plant can express those terpenes. So having different humidity, different temperature, different ways, it'll actually express differently, even if it's the same exact batch, same exact cultivar.
Sure. I mean, that goes back to grapes, for example, right? There's a people when you're cultivating and growing grapes, they manipulate the water content in the soil to make the plant, produce more sugars or do different things at different times, and you end up with a very different product. So let's go ahead and jump into Sativa Indica at the top of less information, then strain, and then cultivar. I think most people, everyone has heard of Indica Sativa, and I think at least within our industry, people are maybe the broader consumer audience isn't, but most people, at least that I speak to, understand that those labels are tend to be misleading because there's a lot of variation in there. And then you have strains which suffer from an issue of slap a label on it. Anyone can name anything, whatever they want. And then what happens when we get to using the descriptor cultivar?
Well, it's either a cultivation variety or a chemical variety. Dr. Ethan Russo, it's my second time quoting Dr. Ethan Russo. He said that a strain refers to a virus. Why would we call this amazing beneficial therapeutic plant a virus? It's not. It's a cultivar, cultivation variety or it's a chemical variety. They're produced as chemicals. So I don't know where we came up with this strain, but maybe we have to start getting away from that. And in general, like this whole indica sativa thing, if you really start looking at the background of thousands of years ago when they discovered the first real true landrace indicas, well, they've actually were found in what would be sort of the Kashmir region of Southeast Asia now. And you look at those plants, and those plants actually were they were in a pretty harsh climate. And when they grew shorter, they grew different fatter leaves. And the reason they actually excrete these terpenes from the research that was done is to make sure that they actually deter their natural predators that were in that space. They were secreting their essential oils, so the natural predators, the bugs, whatever who was eating them, would deter them from eating that. And if you look at those, they actually had this musky, diesely, if you smell them, they were more very heavy in myrcene, very sedative plants. And if you look at the other cultivars that grew in more humid, climates like South Africa or in the islands, they grew differently. They grew tall, skinny, to the sun. The leaves were smaller, and they produced a different type of smell. And those are the original like Durbans in South Africa or the Mauis that grew in Hawaii. However, we crossbred those so many different times. The original Mauis were high in THCV, which is now we're looking at as an appetite suppressant. Maybe there's still some research going on, but because we crossbred so much for higher THC yield, we bred out maybe the other therapeutic cannabinoids that are associated with that. So that's what we have to start looking at. We have to forget the whole indica sativa. We have to look at the buckets. So if the terpene profile is more leaning towards that limonene, pinene, those give you the boost up. If it's leaning towards linalool, myrcene, terpenoline, that is more sedative and calming. So those are the ways we should be able to classify. Once again, testing. Testing has to be uniformly initiated throughout the entire country. I'll give you an example of what Germany doing. Germany actually is covering cannabis with insurance. So you have, these are the conditions that they cover. You go through, you fill out a form, it goes out, insurance approves it, then you go through the process. And these are, they don't have a lot of choices there yet, but these are the ones that are being recommended for you to choose. And you have to come back a month later and see the doctor and see how it's working for you to maintain insurance coverage. So there's different countries that are actually implementing and looking at maybe the mistakes that, we made, for sure Canada made, and maybe states like California that could be improved. And there's, since the global market, there may be others that are doing it differently or better.
Now, do you think from a marketing perspective, because I wear a marketing hat most of the time, so I always come back to this, moving entire industries and moving governmental bodies is difficult / impossible. And I think this is the path that you're on now, but, as a private company, it seems like what you would want to do is create a sense of like a certificate of sort, like a seal of, even though the broader world is not paying attention to these things, these set of products are almost like, I mean, or it's a little broad, but organic or biodynamic wine, right? Which is the thing that some people care about. But there's a category of products in the marketplace that certain consumers, once they've been educated, can look for on the shelf. And maybe it's only 10% of the products on the shelf at a dispensary. But without being able to change government regulation, the only other real path is getting people to, use the power of their wallet and get consumers to push that way, right?
Yeah.
Is that kind of the angle that you're going?
Yeah, I mean, we have an Endo aligned badge that shows that they're in the marketplace, and that's definitely an area we're going. But you're right. I mean, we're not looking to change, and in some emerging markets, we have the ability to work with governments, like in Costa Rica, et cetera. They're just starting this, so we're actually on the ground level. But in the U.S., we're not. So we're not trying to change governmental agencies' minds. What we're trying to do is maybe work with healthcare professionals. So, like we partner with a company called Cannabis Docs, and anybody that gets a card for medical cannabis can now get a bundle with a DNA test. So now that your doctor's recommending cannabis for you, now you can get a little more. Because look, the research says most people try about 3 to 5 different products before they sort of find what works for them. Now, you're spending money for those 3 to 5 products. What if one of those products gives you an adverse event? Depends who you are. Maybe you'll go back. Maybe you'll wait some time to go back. So this is a way to be able to guide you more precisely in that. If people understand the value of precision medicine, we do it for other things. And like I said, outside of cannabis, I would like a more personalized experience. And if people start demanding for that across the board, I believe that, genetic and epigenetic, genetics and epigenetics will just be part of the lexicon. People will start using that, in the next 5 years with the process and the progress of artificial intelligence, Chat GPT, all these different things, what's going on. We will, and precision medical clinics that are opening up all over the place, looking at, functional medicine. These are the ways to be able to get a more personalized experience with whatever you're consuming. So I want to know which vitamins work best for me, which supplements work best for me, what genetic predispositions do I have? And this is a way to be able to look at your own health and wellness and extending your own health and wellness. And your endocannabinoid system is a huge part of that. And it is truly a personalized experience.
Yeah. We might need to come up with like catchier phrases than epigenetic expression, which I think will trip some people up.
All right, I'm not a marketing guy, so I need your help. So I always tell people, when you're born with your DNA, you get 50% from your mother, 50% from your father. So some of the genes, think of yourself internally as a fuse box with a bunch of on-off switches, a ton of them. So when you're born, some of them are turned on. So you're like the ones for your skin color, your eye color, your hair color. Other switches are turned on based on lifestyle. So what you do in your life can turn those switches on. Some of the switches we want to keep off. If somebody has a predisposition to a cancer, well, we want to make sure that whatever we do in our life doesn't turn that on. Or alcohol dependence. If we don't know this, yes, we know that our uncle and our grandparents and everybody else, but we really don't know that about ourselves. So the action that you take with your life can actually determine which switches we turn on and off. So the switches of turning on is your epigenetic. Your genes have your encoding. So that's the information. And the information that goes from the cell with messenger RNA will send that message to turn that switch on or off. Maybe a little too sciencey, but am I getting closer?
No, there's something there. I don't know if we'll get there in 10 minutes. Maybe we'll have another conversation. But no, it is a fun thing to think about. You look at, because cannabis sits in between many worlds or encompasses many worlds, right? So a lot of people take some of it and look at the alcohol industry, and some you can look at CPG for some stuff, and you can look at pharmacy for some things. If you look at the larger brand names and the marketing messages that they have. I mean, people have spent lots of money doing this, but coming up with, short things, right? Like, light beer. Okay. It's not any actually lighter. Like that's a word that we all understand now, but that was a function of marketing. And right. So like, like non-drowsy formula. So yeah, maybe we can brainstorm another time about ways to.
But our tagline was we trademarked this: cannabis is personal. And
Yep.
I have a podcast called Everything is Personal. And so it's not just cannabis, everything is personal. Why is everything like take two of these and call me? And it's an interesting thing that happened during COVID. People telemed wasn't something that everybody did, but during COVID, you were forced to do that. And I think one of the things, the positive part of that is that people started having a collaborative conversation with their healthcare professional. And the more you work on yourself, the more you can have alignment. So take two of these and call me in the morning was yesterday. Now take two of these. Well, why should I take two of these? What do you think? What happens if I take three of these? What happens if I take one? How is that going to affect anything else? Is that going to hurt my liver? Do I have to take something else for that too? So having this collaboration with your healthcare professional really actually helps individuals and helps the healthcare professionals too keep them on their toes, because they learn a lot more. Because every single time we deal with healthcare professionals, it's like, do no harm, right? But if we're doing no harm, but we're also looking at, you know what? I started seeing these people and they seem to be doing really well with this. Why? And the why is in the research that we're doing. Not only are we involved in the research that we're doing, which is observational, we're also involved in clinical trials. So we're in a phase 2 clinical trial with Harvard Medical. Every single person that comes to McLean Hospital gets swabbed, and it's phase 2 already. And then we just published.
Before we move on, what is that? That sounds interesting.
It's phase 2 clinical trial on anxiety and CBD use for anxiety. So that one. Mm-hmm.
And so actually you touched on a couple of them, PTSD, fear extinction, those things are interrelated, anxiety, maybe alcohol dependence. What are the other sort of the top 10 things that you've identified from a genetic perspective that cannabis can have a positive or negative influence on? And let's hold off drug interaction for a second. Let's just assume no one is on any medications at all. What is that, the top sort of 5 or 10 list of?
Yeah, it's stress and anxiety, as you mentioned. It's cognitive function. It's mood and behavior. So depressive states. Mm-hmm. It's pain, nausea, and sleep. Those are probably the 5 major bucket areas where your DNA plays a role, and where phytocannabinoids or your endogenous endocannabinoids actually play a role as well. So if you're looking at those specific conditions, it's been phytocannabinoids have been extremely efficacious in those areas. And those are the areas where your genetics actually play the biggest role.
So cognitive function, does that mean you've got a recipe to make me smarter or learn how to play better?
Well, you don't need to be any smarter. Come on, man.
Oh, geez, come on now.
Focus. Things like
what?
ADHD.
Yeah.
Exactly. I mean, that's the reason why I started taking cannabis in the first place. When I was diagnosed with ADD when I was 13, 14, I think, they put me on medication. And for me, like that medication took out any feeling. Like I could focus, but there's no sense of self. At least that was my experience. When I discovered cannabis, my ADD is like, when you have a million tabs open in your computer, which I always do, that's what's going on in my brain all the time. And with consuming cannabis, it actually helps narrow that and allows me to focus. Maybe I'm doing 2 or 3 things at once instead of 16 things at once, multitasking. So these are the things that you understand about yourself where cannabis can actually be extremely beneficial. Mood is a big one too. My friend was going through a really bad divorce, and he's not a huge cannabis consumer, but he was consuming cannabis during that time. And he called up and said, you always talk about cannabis is good for mood, whatever. It's making me feel more depressed. I'm like, well, what are you consuming? He's like, cannabis. Well, I'm like, but
Yeah.
more specifically, I don't know. So
Yeah.
he gave me the packaging, and it was a very, if you look at it based on his genetic profile, it was a very sedative profile. And we saw in research that people that have the predispositions to depressive moods, they actually do worse with a heavy sedative cultivar or chemical variety. So by modifying his profile, giving him more of a lift up, it changed his whole mood and got him out of bed and started, kicked him in the ass a little bit and got him moving forward. But so it's really, really important to understand, especially if you're already under a certain condition that's being expressed, that switch has been turned on. Well, what you want to do, you may want to turn that switch down with, phytocannabinoids can actually do that too.
Okay, great.
But sleep is a huge one. I'll tell you, a lot of people, I would say pain is the number one reason why people use cannabis, at least with EndoDNA. They come in for pain, and we have a care counselor that speaks to every single individual that takes a DNA test. So we have somebody that can actually guide you through the experience, and all the fancy words and all the sciencey stuff. They can actually have a conversation and show you how to use it correctly, so you don't have to worry about that. But people that call up for pain, if you have a conversation with them, well, how's your sleep? It's all right. It's all right. Well, what's the quality of sleep? I don't know. I don't sleep that well. I wake up 3 times a night. Well, if that happens, you get on this hamster wheel, because if you're not getting restful sleep, then you're agitated during the day and you're on this hamster wheel. You're not resetting. You're not recovering. All these things are really important. So sleep is a really, really huge part where cannabis can play a very, very important role. A mistake that people make is they take too much THC to help go to sleep. So what happens with that is it's like drinking too much alcohol. You can pass out, you can sleep for 8-10 hours, but you're going to feel like shit. And the reason why is you have active brain. So that THC, the anandamide, is actually pumped into your bloodstream, and you have active brain. So being able to take less and a different terpene profile will help you get good restful sleep, that delta, that theta sleep that you really want.
I see a lot of things on the sleep spectrum of CBN or CBG. Maybe that's a longer conversation we have time for. We didn't really get into the other. We talked about terpenes, which I think are you can at least smell them. There's less research on the minor cannabinoids, though. Yeah.
Well, that's the whole thing. I'll answer the question really simply, and we don't have to dive into it. We made a decision. You must have a peer-reviewed reference for us to be able to report on. CBN has no peer-reviewed references yet. When they become available, and we can point to a PubMed study, then we'll include CBN. CBG seems to have a little bit more, and we will be looking at that a little bit closer. There are some studies that they're finalizing. So as research becomes better and included, we'll start being inclusive. We're capturing the minor cannabinoids in the suggestions and what people consume, but we can't point to the minor cannabinoids for any studies yet.
Okay. Great. Well, I'm going to circle back to what I said before. You've got 6 framed photos there behind you. It looks like there's a car. They're black and white. What are those photos you got?
Yeah. So some of them I got as gifts. So this is the Beatles with John Lennon's Rolls Royce. This is Black Sabbath, and some of my favorite bands. And the rest of them are pictures that I actually took at shows that were framed. So this is Snoop.
All right.
That's Kiss doing a unmasked acoustic show of covers in a casino. That is the Rolling Stones, Mick and Keith, and that is Metallica at the Jimmy Kimmel show.
Nice. Those sound like great experiences. Well, we're wrapping up on time here. Everyone, thanks for joining today. This has been Cannabis Marketing Live. I'm your host, Jake Litke. We've had Len May with us today. Len, can you give the audience just if they want to reach out, either your site or you personally, what's the best way to get in touch with you?
Yeah, so we're EndoDNA.com. Personally, my email is Len, Len, at EndoDNA.com. I'm on social, Len May, Lenmay, Len May DNA, I think, Instagram and Twitter. I'm on LinkedIn. I'm pretty active. I I have a book. So if anybody wants to go to Amazon and buy a book, it's called Making Cannabis Personal. It's right here.
There you go.
Dr. Ethan Russo did the forward for this, but the book was written because my business partner said to me, I want to read a book from LAX to JFK. So it's a short read, and it's got a bunch of pictures of me, long hair there, if anybody cares what
Perfect.
I look like. And then I have a podcast called Everything is Personal, and you can get that anywhere you listen to podcasts.
Syndication's pretty good on podcasts now. Great. Well, thanks again for your time today, and we'll chat again soon. I'm gonna go through. I know I've mentioned it before. I didn't get a chance to do it, but I will go through the process and get my DNA map done, and then we'll see what I've been doing wrong all these years.
Hey, the next show, let's go over live your results. And we'll
Okay.
share them with everybody.
Perfect. Yeah, let's do it.
All right.
Great. Thanks, Len. Thank you, everyone. Bye.